Good day everyone, my name is Anna Marie, I'm eating this one season. So today I'm gonna show you how to do the postmortem care. So what is postmortem care? Postmortem care is the continuation of the quality given by the healthcare provider the client after death. So the purpose of this assessment is to provide proper preparation of the body of the deceased client for transfer to a funeral home or morgue. And also it is to prevent that discoloration or deformity of the body. So the materials and the equipments are the clean gloves. It must be 2 pairs, soap, washcloth, towel, basin, clean gown, shroud or sheet, and identification bracelet or a body tag. Next is the procedure, which is assessment. Assess for the presence of family members or significant others and their knowledge of client's death and determine who is legally defined as next of kin, and assess family's brief response, approach next of kin and for organ or the tissues donation, and assess the client's religious preference and or cultural heritage, and to know the limitation in every steps of it is going to do, and determine whether autopsy is planned, and consider any necessary precautions because of client contamination if there was an infection. And it is to prevent that the infections that cannot be harmed or in other people. Next is the planning. Plan for any special religious or cultural practice desired by the family that may need to take to avoid error, and also to place before you begin the actual death care. So wash your hands to avoid cross-contamination and prepare the materials and equipment to save time and effort. The implementation. Use standard protocol to reduce the risk of transmission and assist family to do what they need to do at this time, and have the body placed in a private room or move roommate to avoid the transmission.
Check with significant others about notifying others, significant people. Discuss procedure of preparing the body with significant others. Inquire if there are particular cultural or spiritual practices that are significant for the deceased or significant others. Determine whether family wants to be involved in preparation of the body. If tissue donation has been made, consult policy for specific guidelines in care of the body. Wash hands. Apply gloves or protective barriers as necessary. Identify the body according to agency policy. Leave identification in place as directed in agency policy. If in keeping with agency's procedure, remove all indwelling catheters, IV, oxygen, and other tubes. If an autopsy is to be performed, policy may direct to leave these devices in place. Dress puncture wounds with a small dressing and paper tape. Remove solid dressing and replace with clean gauze dressing. Use paper tape. If the person wore dentures, insert them. If mouth fails to close, place a roll-up towel under the chin. Remove the towel under the chin and position the client as outlined in agency's procedure. In general, do not place one hand on top of the other. Place small pillow or folded towel under the head or elevated head of bed to 10 to 15 degrees. Close eyes gently by grasping the eyelashes and pulling the lids over the cornice. Wash body parts soiled by blood, urine, feces, or other drainage. Place an absorbent pad under the client's buttock. Place a clean gown on the client. Agency policy may require removal before body is wrapped. Brush and comb client's hair. Remove any clips, hairpins, or rubber bands. Remove all jewelry and caption. Family requests wedding band be left in a place. Place a small strip of tape around the client's finger over the ring. If significant others request viewing, place a sheet or light blanket over the body with only the head and upper shoulders exposed. Remove unneeded equipment from the room. Provide soft lighting and offer chairs. Determine whether they would like a staff member to remain. After the significant others have left the room, remove all the linens and the client's gown. Place the body in a body bag or apply the shroud as required by the agency. Label the body as directed by the agency policy. Arrange the transportation of the body to the morgue or mortuary and observe the response of significant others and provide an opportunity to express their feelings.
Last is the use completion protocol. Next is the evaluation. Observes the significant other's response to loss and determine whether the significant others have received appropriate emotional and spiritual support, and note the appearance and condition of client's skin during the preparation of the body and to identify the unexpected outcomes and intervene as necessary to regulate the unessential and to ensure that the clients have the problem while doing the procedure. The last is the documentation. Record and report intervention and clients' response to know what would they feel and also to record to have a legal purpose and have a data in the near future. And that's all. Thank you.